having me here this afternoon. So, as Judy said, my name is Charlotte Rayner. I manage something called the Children and Young People's Mental Health Coalition. I'm here today to talk to you a little bit about who we are, what we do, to set the scene in terms of what the mental health landscape is looking like at the moment for children and young people, and to also talk through some of the policy context and the implications for practice. So before we begin, I just wanted to tell you a little bit about who the Coalition are. So we were established 15 years ago as a way to bring the sector together to campaign jointly on children and young people's mental health. And what we do is we take what our members are saying and what they're doing, and we feed that into policy and lobbying work that we do, and the conversations that we have with national decision makers. And we try to be that representative and reflective voice for the sector, making sure that their voice is represented in all that we do, and that national policymakers really understand what is happening in the children's mental health sector. And just to note that the Coalition, we're not a charity in ourselves, and we sit within another organisation called Centre for Mental Health, which is a small research charity. In terms of our structure, we have a steering group that helps to set the strategic direction of the coalition, and that's made up of 16 of our members. But our member base is really diverse. We have a broad range of members from charities, education settings, youth organisations, individuals. The coalition is really open to anyone and everyone who has a passion and interest in children and young people's mental health, but also wants to be part of that larger campaigning voice and trying to make change for children and young people. I also just want to note that our membership has grown significantly in the past few years. So when I first joined, we had over 200 members. We're now on over 420. And I think this really highlights how people do want to come together. They do want to do joint campaigning work, but also just how much of an issue children's mental health is and how much it impacts so many organisations, and how so many organisations really want to get involved in this work. And then in terms of what we focus on, we updated our strategy last year, which really sets out our strategic priority areas as a coalition. And I don't think any of these will be a surprise to many of us who work in the mental health space, but just to kind of summarize what our strategic priorities are. The first is a mentally healthy generation. So this is looking at how do we reduce those, to contribute to poor mental health, such as poverty, housing, racism and discrimination, and how do we strengthen those protective factors that really are needed for good mental health. This also includes looking at the environments that young people occupy and how do we make sure that they're really mentally healthy spaces. And at the moment, a lot of our work is focused in schools and how we can make sure that schools kind of promote whole school and college approaches to mental health and well-being. Strategic priority is around early intervention for all. So how do we make sure that children and young people have access to a range of early intervention support that spans schools, the community, but also digitally as well. And then finally, our third priority is around strengthening specialist mental health services, so making sure that they have the funding and resources that they need for children and young people to be able to access those services in a timely way. But also, a new area for us that kind of came out in this strategy is looking at crisis care and how we can ensure that children and young people have access to high quality crisis care. And it's really the reason why we exist and why the focus on children and young people is so crucial is that we know that half of all mental health problems are established by the age of 14. So the earlier that we can intervene, the earlier that we can provide support, and the earlier that we can make sure that children and young people have all of those protective factors, the greater their life chances are going to be as they grow older. Unfortunately, though, we have seen rising mental health need, and it has been rising. Mental health problems have been rising significantly over the past decade. The latest prevalence survey from NHS England was conducted in 2023, and that told us that 1 in 5 children and young people now have a mental health problem. That was an increase from 1 in 9 in 2017, and an increase from 1 in in 2004. And we know that need was rising before the pandemic, but the pandemic kind of really pushed and amplified that need, and that high level of needs since the COVID-19 pandemic has really kind of sustained and leveled out, and there's no indications at this point in time that that level is declining. And sadly, we know that suicide is the most common cause of death for both boys and girls who are aged between 5 and 19. We also know that children and young people really struggle to get the support they need. High thresholds for support, rejected referrals, and long waiting times are really kind of the main components to the children's mental health system. And as a result, children and young people face significant challenges in accessing the support they need. This was highlighted most prominently recently in the Darzi investigation of the NHS, who also pointed to the rising need in mental health amongst children and young people, and how the healthcare system is really struggling to respond and to support children and young people. The lack of early intervention support that we have, and the gaps in specialist services and a lack of capacity in specialist services means that more young people are showing up mental health crisis. So in 2023-24, there are around 5 million attendances to emergency departments by children and young people, of which 64,000 of those had a primary diagnosis of a mental health condition. And most stark, over 85% of those young people who turned up in A&E with a mental health problem were already known to mental health services, which really just seeks to highlight that there are gaps in services and young people are having to turn to A&E in crisis because there is nowhere else for them to turn. So what is being done about all of this? In terms of the policy context, I'm going to start what this new government are doing, because it is obviously very relevant to what's happening now. And the government came in on their manifesto, which committed to raising the healthiest generation of children ever. And within this, they made several commitments to improving mental health support for children and for young people. This included having a mental health specialist in every school, rolling out these things called Young Futures Hubs, which will provide open access drop-in mental health support in every local area. So really seeking to provide that early support in community spaces. They committed to reforming the Mental Health Act, and apologies, I've just noticed the date for the Mental Health Act is wrong on my slides. It should say 1983, not 1985. We know the Mental Health Act is massively outdated, and work has been going on for the past 5 years to reform and modernise the Act, and we now have a mental health bill passing through Parliament to achieve that. One of the main components of the government's mental health commitment is about increasing the mental health workforce. And you might often hear the number 8,500 being rolled out. They're committed to increasing the workforce by 800,500 people, but we're not too sure what proportion of that equates to children and young people's mental health services. And really positively, we have seen some good progress made so far by they committed in the last budget to roll out mental health support teams in 100% of schools and colleges by 2029, 2030, and this will really seek to meet their commitment to provide a mental health specialist in every school. Mental health support teams were introduced back in 2018 under the previous government, and they seek to provide support in schools and colleges for those with mild to moderate needs. Coming back to Young Futures Hubs, they said these will be established in every local area, and they're committed to establishing 50 hubs will be launched over the next 4 years. I will leave you all to think about whether 50 hubs is enough. I don't think it is, but 50 hubs over the next 4 years is what we're going to see in terms of Young Futures Hubs. And Young Futures Hubs, as I said, will provide open access drop-in mental health support, but they'll also look at how they can prevent young people from being drawn into crime, and also look at how they can provide careers, advice and support to young people. As I said, we've now got a mental health bill going through Parliament, which will reform the Mental Health Act. That is due to go into report in Commons next week, and we hope that it will be passed by the end of the year. And then finally, there's going to be a national youth strategy, which we think will be published in the winter. And this is really kind of going to set out the government's commitments and all that they're doing to support children and young people. But I think one of the biggest focus of areas for the government has been their ambition to reform and modernise the NHS. And back in July, they published their 10-year health plan, which sets out their plans for how they're going to modernise the NHS, but also how they're going to improve care and treatment for patients. The plan centred on three key shifts. Firstly, from sickness to prevention, so looking at how the NHS can shift focus from treatment from illness to preventing illness. Secondly, from hospital to community, so how can the NHS deliver more care in local communities rather than depending on hospitals? And then finally, looking at how the NHS can embrace and make use of new digital technologies. And within this plan, there were some specific commitments on mental health. I think coming back to that shift around transforming care from hospitals into communities, there is an ambition within the plan to transform mental health services into 24/7 neighbourhood care models. So really moving care into local communities, into local neighbourhoods. The plan reinforces those commitments to provide support in schools through mental health support teams and in local communities for young people through Young Futures hubs. It commits to addressing the long-standing issues within specialist mental health services for children and young people, but it doesn't yet provide any detail on what that will be, how they will address those issues. There was a commitment to invest £120 million to establish mental health emergency departments to remove that reliance on A&E when people are in mental health crisis. But again, we're not too sure what that means for children and young people to be a predominantly adults focused service. And then finally, they have committed to developing a new modern service framework for mental health services. So looking at how mental health services are delivered and updating the framework for local areas to use. So what does all of this mean then for us in policy, but also in practice, and those conducting research as well? Within this, I've thought about the implications challenges that still exist as well. And I don't think we can talk about any of this without touching on funding. We are working in a context where integrated care boards are having to make up to 50% cuts at the moment, meaning they're having to they have very little resource to make all of this change that is needed. And given this kind of challenging fiscal climate, we're always being told there is no more money, we have no money, we've got. This means that the reform agenda won't come with new money, and they will be looking at where the money is in the system and how they can reuse and repurpose existing funding. I think within this as well, what's kind of becoming clear is that the government are really keen to think about test and learn approaches for new or kind of under evidence interventions, particularly in relation to early intervention and prevention. You might also be aware that there is this worrying narrative that's emerging around mental health problems in children and young people being overdiagnosed. And it's really an attempt to explain away this rise in mental health need, that it is just an overdiagnosis problem. But actually, this is really concerning, and we're really worried that this overdiagnosis narrative risks obscuring the reality that many children and young people are facing today. It's clear that there is a real genuine rise in need, and to characterize this rise in need as overdiagnosis really overlooks those structural drivers of distress, such as stagnating living standards, rising poverty, the impact of the pandemic, and also the pressures of the online world, as well as the fact that services just remain chronically underfunded and inaccessible. And we're really concerned that by focusing on overdiagnosis, issues in services, the issues in living standards, those more structural issues will be left unaddressed. So this is something that I would call all of us to really challenge and think about in a work we're doing, we need to be really clear that what is happening in relation to mental health at the moment is not an overdiagnosis issue. There is a real genuine rise in need in children and young people, and we really need to make sure that services get the funding they need to be able to support young people. Linked to this then is making sure that evidence is key, as always, not only to demonstrate that there is a need out there, but also the value of delivering interventions and the cost effectiveness of those interventions as well. As I said, the government are really keen to look at value for money. There is going to be no more money. And the phrase we always hear is low cost, no cost solutions. And then finally, there really is this emphasis now on neighbourhood, locally based care. And I think that's really important when we're thinking about interventions, research, is there is this shift to giving local systems more autonomy to be able to make the decisions, set up services, and have care more based in local communities. To end on giving you a bit of an example of what we've done to translate policy into practice. And this is something that we've been working on for the past 5 years now, called the Fund the Hubs campaign. The Fund the Hubs campaign is a sector-wide campaign. There's 8 organisations that are part of it, and the Fund the Hubs campaign has been calling for a national network of something we're calling early support hubs, which will provide early support for young people's mental health when their problems first start to emerge. This campaign came out with a recognition that there is a lack of early support for children and young people in local communities, and that there are these services that already exist that provide an accessible model of support. And we really thought that actually we need to have more of these services across the country. The campaign started as a very public campaign. We had petitions, we had letters to various ministers, the Prime Minister, we had social media actions, we had young people going to Downing Street, and we were really trying to build up momentum and get public support for the campaign. Whilst we were doing that in the background, we were seeking to build really good relationships with government, particularly the Department of Health and Social Care, and we were presenting evidence on why this hub model worked. Evidence is, I think, somewhat limited in this country, so we were looking at international examples of evidence as well. Particularly in Australia, they have the Headspace model, and we were looking at translating that in context. We also offered visits to services, connected them with service providers, connected the department with young people as well that they could speak to really demonstrate the evidence of need. Really luckily for us, 3 years later, so 3 years of public campaigning and also trying to do some private influencing, the government committed to funding a small scale pilot of early support hubs. So 5 committed, but then a year later they committed a further 3 million, and this was a pilot for existing hubs to kind of demonstrate the work that they were doing, and it also came with funding for an evaluation so that the government had a stronger evidence base going forward to kind of make the case. And then last year, as part of the Labour Party manifesto, we also worked with local Labour advisors. We provided them costings on hub services. We also provided evidence as well, and they committed to establishing open access mental health hubs in their manifesto, which we're now calling Young Futures hubs, and they've now become a core component of the government policy around children and young people's mental health, and we're now working to think about what implementation of those hubs looks like. So I just thought that was a nice example to end on, to show how kind of years of campaigning, but also building the evidence, building really strong relationships can really help translate that policy into practice. So that's it from me, and I think there's some time for questions, and I'll stop sharing my screen.